Welcome back to For the Record. COVID-19 vaccinations have now been open to everybody in the state 16 and up for a full week. And as we review COVID-19 and vaccinations across Wisconsin, I'm joined next by Karen Timberlake, Secretary-Designee of Wisconsin's Department of Health Services.
Good morning. Thanks so much for joining us today. Why don't we start with rising cases? There's a bit of an uptick still in COVID cases in Wisconsin. Do we feel like vaccinations are going to meet that rise and eventually balance it out before we reach a larger, more serious spike?
So I think it's really important for people to realize that we really are in a race right now between our efforts to get everybody vaccinated just as fast as we can and the fact that COVID is still out there, it is still circulating, it is still very contagious. And as you point out, we are seeing cases go up a little bit. So what that means to us is really two things. First, it's really important for people to continue to do what they can do to protect themselves from COVID. So wear your mask when you're out in public. It's really important for our businesses to continue to encourage people to wear masks, particularly when we're indoors. It's important for people to keep their social circle small, particularly if people haven't yet been vaccinated, keep good physical distance. And the weather is beautiful. Let's all be doing more outside because we know that it's harder for the virus to spread when we're outside. In addition, we now have absolutely everyone in the state age 16 and up eligible to be vaccinated.
We had an outbreak of about between 30 and 40 people at a child care center here in Dane County traced to the UK variant. How concerned are we about these variants driving up those cases in Wisconsin?
Right. I think that's a great example of the fact that COVID is still around, and it is, in fact, highly contagious, as that outbreak shows us. We know that at least 3 of the new variants of COVID are circulating in Wisconsin. This is a virus. It's going to continue to mutate, and as it mutates, it can become more contagious and just create more challenges for us in general. So that's why, again, I go back to those good preventive measures of mask wearing, hand washing, physical distancing, and get vaccinated as fast as you can. One of the things that our medical experts are telling us is that as we have more people vaccinated, we will slow the spread of the virus, which will slow its opportunity to mutate. And the other thing I'll add is that for people who are feeling sick, feeling like they might have COVID symptoms, please continue to get tested. I know we don't talk about COVID testing so much anymore, but when people get tested, that's what gives us the opportunity to identify the new variants and really keep our understanding of the virus as current as it can be.
Last week, state officials were expecting a rise or a steadily increasing rise in J&J vaccine allocations to the state. Now the CDC is telling every state those allocations are going to be down. We had 85,000 this week. Next week now projecting we're only going to be getting 10,000. And, that's after, of course, that manufacturing error of J&J. So how does the state pivot to that as we have all this eligibility open? How does the state pivot to meet that lower allocation?
So a couple of important things for everyone to understand. First, we have 3 very safe, very effective vaccines, the one made by Pfizer, the one made by Moderna, and the one made by Johnson & Johnson. We are continuing to see good, steady supplies of Pfizer and Moderna. And in fact, if you look at where we are today with those vaccines as compared to where we were just 6 or 8 weeks ago, we now get twice as many first doses of Pfizer and Moderna into the state as we did just a couple short weeks ago. So that's really very good news. We've been told consistently by our federal partners that supply of Johnson & Johnson was going to fluctuate. Obviously, a drop from 80,000 cases to 10,000 cases is a little more of a fluctuation than we all would like. But with that said, we work hard every week with our vaccinator partners all across the state to understand what their capacity is and to match the supply that we have to the capacity that they have to give vaccine. So what I think this means for everyone is vaccine is still available. It's available in lots of places all across the region. And we would encourage you to call our toll-free number, look on the website, consult with your own doctor's office, your own pharmacy, and find yourself a vaccine. It may take a few weeks, but we will have vaccine for everybody who wants a vaccine at this point.
If we have been anticipating that J&J manufacturing error, do you think the state would still have opened up all eligibility as soon as we did? Would that have changed anything?
Yep, no, I don't think so at all. Because again, our goal is to make sure that we have a steady stream of people